You think going to the doctor today is bad? Long waits, insurance that covers nothing, a physician who barely looks at you. Fine. But at least nobody's sticking a rusty needle in your stomach while smoking a cigar over your face. In the second half of the 1800s, American medicine wasn't a science. It was an experiment, a live one. And you were the involuntary test subject. A man showing up with a fever at an Old West clinic had roughly equal odds of walking out cured or walking out with a brand new problem he didn't have when he arrived. The worst part? He paid for it, paid good money, said thank you, and came back the following month. Because what was about to unfold in American medicine was so disturbing, so absurd, and so full of unshakable confidence in methods that were completely wrong. It'll make you want to hug your health insurance card tonight with tears in your eyes. The scalpel that never met soap. Before 1885, most American surgeons operated without washing their hands, not out of forgetfulness, out of principle. The dominant theory was that a good surgeon was recognized by the blood-stained apron he wore with pride, like a battle badge. Washing your hands before surgery was considered a waste of time, when it wasn't seen as flat-out cowardice. Dr. Joseph Lister had already proven since 1867 in England that hygiene dramatically reduced surgical deaths. The American medical community's response was, basically, a shrug. It took nearly 20 years for surgeons in the country to adopt what any bar cook already knew to do before flipping a burger. Meanwhile, patients went into operations, picking up infections that the scalpel itself carried from inside that apron. The handshake of a 19th century American surgeon was literally more dangerous than the disease he was trying to cure. The American doctor's favorite leech. If you walked into an American clinic between 1840 and 1870 with almost any complaint, the doctor had one solution. Take your blood. Headache, bloodletting, fever, bloodletting, pneumonia, double bloodletting. The theory of bodily humors, a Greek inheritance over 2,000 years old, said the body got sick when its internal fluids fell out of balance. The cure was to drain the excess. The problem is that the excess they wanted to drain was the blood you needed to stay alive. President George Washington died in 1799 after losing nearly 2.5 liters of blood in less than 1 day, courtesy of 4 doctors trying to cure a throat infection. 2.5 liters. We donate half a liter at a blood drive and feel dizzy. Washington was drained 5 separate times. American medicine literally bled one of the founding fathers to death and then went home for dinner. Whiskey as the official anesthesia of the United States. During the Civil War, from 1861 to 1865, Army surgeons performed over 50,000 amputations. Chloroform and ether already existed and were being used, but when supplies ran out, and they ran out often, the solution was to shove a whiskey bottle at the soldier and tell him to bite a leather strap. The phrase, bite the bullet, isn't a metaphor. Soldiers actually bit musket balls or pieces of wood while the saw cut through bone. The average amputation took 2 to 3 minutes, because surgeons were graded on speed, not precision. One of the fastest, Dr. Thomas Morton, completed leg amputations in under 2 minutes. The downside of being too fast showed up during one operation where he accidentally amputated his own assistant's fingers and sliced the coat of an observer, who died of shock. The mortality rate for that one surgery was 300%, not a typo. The doctor who sold opium to babies. In the 1800s, babies who cried too much had a quick solution widely recommended by doctors themselves: laudanum drops. Laudanum was a mixture of alcohol and opium that came in elegant little bottles with reassuring labels like soothing syrup for babies or drops for infants. The active ingredient was liquid morphine. This was given to a 6-month-old because he had colic. The baby stopped crying immediately, which parents interpreted as a cure. And what was actually happening was the baby lying there, doped on opium, staring at the ceiling with no idea what was going on. This product was sold legally in the United States until 1906. When the Pure Food and Drug Act required manufacturers to list ingredients on the label. Before that, they didn't even have to say what was inside. An entire generation of American children was calmed down with opium derivatives, and parents walked out of pharmacies delighted, convinced they had discovered the secret to peaceful parenting. Cocaine at the dentist's office. In 1884, American eye doctor Carl Koller discovered that cocaine was an effective local anesthetic. The news spread through the United States faster than yellow fever. That same year, American dentists started injecting pure cocaine into patients' gums before pulling teeth. It was technically innovative. It was the first truly functional local anesthesia dentistry had ever seen. The problem is, nobody had studied what happened to the patient after the extraction. The patient knew. Heart racing, euphoria, the world feeling wonderful despite having just lost a molar. Many patients came back to the dentist complaining of toothaches that didn't exist. Others developed a habit of, let's say, experiencing dental needs with surprising frequency. Dr. William Halsted, one of the most important surgeons in American history, tested cocaine on himself during research in 1884 and stayed addicted for the rest of his life. American medicine thought it had discovered the perfect drug. It was right, as long as you didn't care too much about what came next. Radiation, everyone thought was fun. When Wilhelm Röntgen discovered X-rays in 1895, America flew into a frenzy of curiosity. In the following years, X-ray machines showed up at fairs, shoe stores, and doctors' offices all across the country. At fairs, people paid to see their own bones on a fluorescent screen and walked away laughing, impressed with themselves. Shoe stores used fluoroscopes, which were full-foot X-ray machines, to show customers whether a shoe fit correctly. Children would stick their foot in the machine and stand there staring at their own bones for minutes at a stretch, while the salesman convinced the mother the shoe was perfect. Dr. Miron Kasabian, a Philadelphia radiologist who operated these machines in the early 1900s, lost all the fingers on his right hand from chronic exposure, developed cancer, and died in 1910. Meanwhile, children all over the country were standing in shoe machines absorbing doses of radiation no doctor today would approve for even 1 second. A cure-all that killed for nothing. In the second half of the 19th century, American pharmacy shelves were a horror museum with nice packaging. There were remedies for arthritis, asthma, coughs, melancholy, weakness, shyness, and even lack of ambition. The real ingredients didn't have to appear on the label until 1906. So Hamlin's Wizard Oil, the best-selling remedy of the 1880s, contained 85% pure alcohol. Dr. Kilmer's Swamp Root promised to cure kidney problems and contained, among other things, a generous amount of alcohol. Peruna, a bestseller in the early 1900s, was 28% alcohol, was marketed as a catarrh remedy, and was actually recommended by members of the United States Congress. Members of Congress, recommending a bottle of cheap alcohol as medical treatment. Some Prohibition-era states bought Peruna in industrial quantities because it technically wasn't an alcoholic beverage. It was medicine. Sure it was. The dentist who operated on heroin. Before 1880, going to the dentist wasn't an appointment. It was a visit to the bravest blacksmith in town. Most Old West American dentists had no formal training whatsoever. Anyone with a pair of pliers and enough nerve to handle the noise could call themselves a dentist. Edgar Randolph Painless Parker, who operated across the United States between 1892 and 1950, legally changed his surname to Painless so he could use it in advertising. Before pulling teeth, he smeared patients' gums with a paste that contained heroin. He called it a special dental anesthetic. It worked very well. Parker operated out of circus tents, fairs, and in the street, with a band playing loud music in the background to cover the screaming. In a single day in Oakland in 1902, he extracted 462 teeth. 462. He kept every single one and wore them on a necklace around his neck as a trophy, and you're complaining that your dentist doesn't run on time. The surgery performed without seeing the patient. In the American Old West, the distance between towns was measured in days on horseback, and most rural areas had no permanent doctor. When one showed up, it was a kind of social event. People rode in from long distances with lists of complaints they'd been stacking up for months. The traveling doctor, or circuit doctor as he was called, covered set routes and treated everyone who showed up, for any problem, on the same day. A single doctor might see 50 patients in 12 hours between deliveries, amputations, dental work, and fevers of unknown origin he labeled bilious because it was the most versatile word of the century. But the most disturbing part was what happened when the doctor didn't show. Families performed surgeries at home following instructions sent by letter or by a man on horseback. There are records of amputations performed by relatives using carpenter's saws, based on written instructions from doctors who'd never laid eyes on the patient. If the surgery worked, the doctor got the credit. If it didn't, it was God's will. Heroin sold at the corner pharmacy. In 1898, the Bayer Company, which you know from the headache pill, launched a new product on the American market. The trade name was Heroin. No euphemism, no code. Heroin. It was sold as a cough remedy, a non-addictive substitute for morphine, and a treatment for children with bronchitis. Non-addictive. Bayer's marketing department made this claim with complete seriousness, based on clinical tests conducted by the manufacturer itself. Heroin was sold in American pharmacies without a prescription until 1913, 15 years after launch. Children with coughs drank heroin syrup. Adults with headaches took heroin tablets. Soldiers coming back from war were given heroin as a substitute to treat the morphine addiction they'd developed in the field. The result was exactly what anyone with half a brain would expect, an addiction epidemic that the country spent decades starting to understand. But at least the cough went away. The Doctor Who diagnosed by smell. Before blood tests, urine tests, blood pressure readings, or any modern instrument, American medical diagnosis was a performance art based on observation, intuition, and frequently, smell. 19th century doctors were trained to smell the patient as part of the physical exam. Sweet-smelling urine indicated diabetes. Sweat that smelled like fermenting bread could indicate typhoid fever. Fruity breath could be ketoacidosis. In some cases, this method had real grounding in body chemistry. And the problem was what came after the diagnosis. A doctor who correctly identified diabetes by smell in 1860 had no insulin to give the patient. Had nothing. The correct diagnosis handed the patient the information that they were going to die, with 0 treatment options. It was like a weatherman who predicts the earthquake with complete accuracy, but can't warn anyone. Precise and completely useless at the same time. The doctor charged for the visit anyway. The asylum that wasn't for the crazy. In the 19th century, any American woman who consistently defied her husband could be committed to an asylum with a diagnosis of hysteria, which was an official medical term. This isn't an exaggeration. It was documented, legally accepted practice. Women were committed for reasons that literally included talking too much, disagreeing with a husband in public, refusing marital relations, having opinions about politics, feeling sadness for an extended period, and expressing a desire to work outside the home. A doctor signed the paper. The husband dropped off the wife. The wife stayed until the husband decided she was cured. The cure frequently consisted of isolation, ice water baths, electricity applied to the head, and forced bed rest. Elizabeth Packard was committed in 1860 by her husband because she disagreed with him on religious matters. She spent 3 years in an Illinois asylum. After she got out, she founded an organization and fought for years, until she won legal reforms, making commitment without a hearing more difficult. Her husband was furious, of course. The cigarette prescribed by the doctor. In the 1890s, cigarettes were sold in American pharmacies with a medical leaflet. This wasn't false advertising, it was formal clinical recommendation. Doctors prescribed cigarettes to patients with asthma, claiming that the smoke dilated the bronchial tubes and relieved attacks. There were specific cigarette brands positioned as therapeutic products, with endorsements from real doctors whose names appeared in the ads. A product called Dr. Batty's asthma cigarettes, sold between 1860 and 1930, was explicitly recommended for asthma, catarrh, hay fever, and throat irritation. The same cigarette for children over 6 years old. The logic was that warm smoke would irritate less than cold outdoor air. And the advertising worked because patients genuinely felt temporary relief, which was the bronchospasm being masked by nicotine, which is a very short-acting bronchodilator. The relief lasted 20 minutes. The addiction lasted a lifetime. Classic American medicine cost-benefit analysis. The lobotomy performed with an ice pick. In 1946, Dr. Walter Freeman performed the first transorbital lobotomies on an outpatient in the United States. The surgical instrument he used to reach the brain was a kitchen ice pick. For real? Freeman took the tool, hammered it through the orbital bone above the eye, and stirred the frontal lobe like someone swirling a bowl of gelatin. The operation took 10 minutes. Freeman performed over 3,400 lobotomies in the United States, often in converted vehicles he himself called the Lobotomobile. He operated in asylums, traveling the country like a traveling salesman except for brains. Rosemary Kennedy, sister of future President John Kennedy, was lobotomized in 1941 at age 23. She went into the procedure with minor emotional difficulties and came out with the mental capacity of a small child. She lived the rest of her life, over 60 years, in an institution. Freeman kept operating until 1967, when he was finally barred from surgery after killing a patient during her third lobotomy. The radium water that rich people drank. In the 1910s and 20s, there was an American luxury product that promised vitality, vigor, and cures for everything from arthritis to impotence. It was called Radithor. It was distilled water with radium and mesothorium dissolved in it. It cost $1 per bottle, the equivalent of about $30 today, and was considered an elixir of the upper class. Pittsburgh industrialist Evan Byers, a wealthy and well-connected athlete, began drinking Radithor in 1927 after injuring his arm. He drank 2 to 3 bottles a day and said he felt wonderful. He drank over 1,400 bottles over 3 years. By 1931, he weighed 82 pounds. His jawbones had disintegrated. His skull was literally falling apart from the inside. He died in 1932. The Wall Street Journal published his story under the headline, "The Radium Water Worked Fine Until His Jaw Fell Off." And that remains one of the greatest newspaper headlines in American history. The childbirth that killed more than the disease. In 19th century United States, childbirth was technically assisted by male doctors in cities and by untrained midwives in the countryside. In both cases, maternal mortality rates were alarming. The main problem in urban maternity wards was puerperal fever, caused by exactly the lack of hygiene we already mentioned. But there was something more specific. Doctors who delivered babies also performed autopsies, often on the same day, without washing their hands in between. Dr. Ignaz Semmelweis had demonstrated in 1847 that washing hands between autopsy and delivery reduced maternal mortality from 18% to under 2%. American and European doctors at the time rejected the theory because the idea that their own hands could kill patients was considered offensive to professional reputation. Semmelweis died in an asylum in 1865, committed against his will. He was right about absolutely everything. Dirty hands kept killing mothers for decades after his death. The corset that doctors told you to wear. In the 19th century, American middle and upper-class women wore corsets that compressed their waists to the point where lower ribs were displaced and internal organs shifted position. Waists of 20 to 22 inches were the ideal, and for many women that required tightening the corset to the physical limit of endurance. The disturbing part is that doctors didn't just tolerate this, many recommended it. The theory was that upright posture and external support were healthy for the spine. There were doctors who argued that women without corsets risked organic collapse and muscular weakness. When women complained of fainting, difficulty breathing, and rib pain, the frequent diagnosis was hysteria and the treatment was rest, wearing the corset. The corset compressed the diaphragm to the point where deep breaths were physically impossible, which explained the frequent fainting of Victorian women. It wasn't feminine fragility, it was suffocation. Fashion was killing them and medicine was signing off on it. Electroshock applied to cure homosexuality. Homosexuality was listed as a mental illness in the official American classification of psychiatric disorders, the DSM, from 1952 until 1973. 21 years of official diagnosis. During that period, gay men and women were referred for medical treatment that included electroconvulsive therapy, psychiatric commitment, and aversion therapy, which consisted of applying electric shocks or inducing nausea while the patient was exposed to images of same-sex individuals. The stated goal was to create a negative association with homosexual attraction. The result was severe psychological trauma with no change in sexual orientation whatsoever, which was documented even at the time by the very researchers conducting the treatments. This wasn't ignorance. It was a deliberate choice to treat as pathology, something the researchers' own data didn't support as a disease. The removal from the DSM in 1973 didn't come from a new scientific discovery. It came from a democratic vote inside the American Psychiatric Association. Science by popular vote. The surgery without anesthesia, because the doctor didn't believe in it. Ether was first used as surgical anesthesia in a public demonstration in 1846 in Boston. It was a transformative event that changed surgery forever. The problem is that a significant portion of American surgeons in the following years refused to use anesthesia for reasons ranging from religion to pure stubbornness. There were surgeons who believed pain was necessary for healing, that the shock of pain kept the body alert during recovery. Others said anesthesia was too dangerous and preferred to operate fast, as if speed replaced the problem of feeling everything. And there were those who simply thought the new technique was a fad pushed by young doctors. Patients arriving at hospitals in the 1850s and 60s could, depending on which doctor they drew, undergo surgery with anesthesia or wide awake, screaming, being held down by nurses while the surgeon operated like this was completely normal. Because for some of them it was. The city water that contained lead. Lead was the preferred material for water pipes in the United States throughout the 19th century and into the 20th. The word plumber comes from the Latin plumbum, meaning lead, because it was literally the metal plumbers worked with. American public health authorities knew as early as the 1890s that lead in pipes contaminates water, especially acidic or hot water. They knew and did nothing for decades. The city of Providence, Rhode Island, published a report in 1892 documenting lead poisoning in young children caused by tap water. The report was filed away. In the 1920s, Standard Oil began adding tetraethyl lead to gasoline as an anti-knock additive, and that same lead went into the air, the soil, and the water. The Flint, Michigan story that became a national scandal in 2015 when the entire city was poisoned by lead-contaminated water wasn't a new tragedy. It was the continuation of a 100-year policy, the orphanage that used children as guinea pigs. Between the late 19th century and the mid-20th century, American orphanages and child welfare institutions were routinely used by medical researchers as a source of test subjects. Children without parents and without active legal guardians represented a convenient population for tests that couldn't be done on children with families present. In 1921, scientist Henry Hyman deliberately infected children at a New York orphanage with gonorrhea to study the disease's progression. There were precedents, and there was continuity. The most systematic case was the Willowbrook State School in New York State, where between 1956 and 1970, researchers from New York University deliberately infected intellectually disabled children with hepatitis to study the disease. Parents were told that infection was inevitable given the institution's environment, which was partially true, but omitted the fact that the infection would be deliberate. The experiment was published in respected scientific journals. Nobody went to prison. The black doctor who saved more lives than any white man. Daniel Hale Williams was born in 1856 and became a surgeon when American medicine practiced active segregation in its hospitals. Black doctors couldn't practice at white hospitals. Black patients frequently received inferior care or were turned away entirely. In 1891, Williams founded Providence Hospital in Chicago, the first interracial hospital and the first nursing school for black women in the United States. 2 years later, in July of 1893, a man named James Cornish arrived with a knife less than 1 inch from his heart. Williams opened the chest, repaired the pericardial sac, and closed. Cornish survived and lived 15 more years. It was the first documented successful cardiac surgery in American history. Williams didn't publish the case immediately. He had no access to the main medical publications. When the case made news years later, another white doctor disputed the credit. Williams died in 1931. The hospital he founded still exists. Alcohol as the official medicine during Prohibition. The American Prohibition lasted from 1920 to 1933. But there was an enormous hole in that law. Doctors could prescribe whiskey as medicine. The law expressly permitted the medicinal use of alcohol. The federal government set a quota of 1 pint of whiskey every 10 days per patient, which was roughly half a liter. Doctors quickly realized that medical whiskey prescriptions were an extremely profitable business. In the first year of Prohibition, medical whiskey prescriptions in the United States increased over 400%. There were doctors who saw hundreds of patients per week exclusively to prescribe whiskey. Press magnate William Randolph Hearst obtained whiskey regularly through medical prescription. The Walgreens drugstore chain grew from 20 stores to over 500 stores during Prohibition, largely by serving as a distribution point for medicinal whiskey. Prohibition banned alcohol for everyone, except those who could afford to pay a doctor. The vaccine that almost killed the vaccination program. In April of 1955, the United States launched the polio vaccine developed by Dr. Jonas Salk to national celebration. It was a genuine medical triumph. Polio had paralyzed or killed tens of thousands of American children for decades. The vaccine worked. The problem came from Cutter Laboratories, one of the factories authorized to produce it. Due to a failure in the virus inactivation process, the company distributed batches containing live virus. 120 children developed polio from the vaccine that was supposed to prevent the disease. 56 were left with permanent paralysis. 5 died. The vaccination program was immediately suspended. The national panic was real. What gets told less often is that the American government resumed the program weeks later, with stricter controls, and vaccination continued. The Cutter incident, as the case became known, resulted in the first federal quality control regulations for vaccine manufacturing. The tragedy produced the safety system that protects vaccinations in the United States to this day. The morning sickness, a drug that deformed babies. Thalidomide was approved in several countries as a remedy for morning sickness in pregnant women in the late 1950s. In the United States, approval was blocked by pharmacologist Francis Kelsey, an FDA official who demanded safety studies the manufacturer hadn't done. The German company Chemie Grunenthal pressured the FDA directly to approve the product without the tests. Kelsey refused 4 times. In Europe and other countries where thalidomide was approved, over 10,000 babies were born with phocomelia, a condition where the limbs don't fully form. In the United States, the number was significantly smaller, but not zero. There was exposure through test samples distributed by doctors. Francis Kelsey received in 1962 the Distinguished Federal Civilian Service Award, the highest American civilian honor, directly from the hands of President John Kennedy. She had held back the approval for 2 years while the company pressured her. Her bureaucracy saved thousands of American children, the Tuskegee experiment that lasted 40 years. In 1932, the United States Public Health Service began a study in Tuskegee, Alabama, with 409 black men with syphilis and 201 black men without the disease as a control group. The stated objective was to study the natural progression of untreated syphilis. Participants were not informed of the real diagnosis. They were told they had bad blood, a vague local term, and that the government would pay for treatment. What they received were placebos. In 1947, when penicillin became the standard treatment for syphilis, researchers deliberately withheld the antibiotic from participants. The study continued for 40 years, until 1972, when a whistleblower named Peter Buxton leaked the story to the press. When the study was closed, 28 men had died directly from syphilis, 100 died from related complications, 40 wives had been infected, and 19 children were born with congenital syphilis. The American government issued an official apology in 1997. The study lasted 40 years. The apology took 25 more. The surgeon who operated drunk. In the American Old West, medical boards didn't function in most territories. Anyone could open an office, buy instruments, and start operating. But even in states with some minimal regulation, the concept of professional fitness was interpreted very generously. There were surgeons who drank before and during surgeries, and this was known by the community, tolerated by patients, and ignored by the few authorities that existed. Dr. John Doc Holliday, who became famous for the gunfight at the OK Corral in 1881 in Tombstone, Arizona, was a trained dentist. He had tuberculosis and drank heavily. He continued practicing dentistry as long as his health allowed, which is a thought that should not generate comfort in anyone. The history of American doctors and dentists who operated while intoxicated isn't folklore. It's documented in court cases and newspaper accounts of the time. The difference between the Old West and today isn't that doctors stopped drinking. It's that now there's at least someone to ask. The nurse nobody wanted to listen to. Clara Barton worked as a volunteer nurse in the American Civil War, starting in 1861, going directly to battlefields when the Army refused to accept women in formal nursing positions. She organized, on her own, a system for collecting and distributing medical supplies that the Army couldn't maintain. In 1862, during the Battle of Antietam, the bloodiest battle on American soil with over 22,000 casualties in a single day, Barton was operating less than 20 yards from the front line. A bullet passed through the sleeve of her blouse and killed a soldier she was treating. She kept working. In 1881, she founded the American Red Cross after spending years trying to convince the government to create a disaster response system. The government said there was no need. In the same year, she founded the Red Cross. A flood killed over 200 people in Michigan. The American Red Cross was created 16 years after Barton first started asking, the doctor who invented America's morning cereal. Dr. John Harvey Kellogg ran the Battle Creek Sanitarium in Michigan, a kind of medical resort for wealthy Americans who wanted health through diet and natural treatments. It was the 1890s. Kellogg was a Seventh-day Adventist who believed that meat, alcohol, coffee, and sex corrupted the body and mind. He invented cornflakes in 1896, originally as a bland, flavorless food with no stimulants meant to help patients control their impulses. That's right, America's most famous breakfast cereal was created as a remedy for reducing sexual desire. Kellogg's brother Will took the recipe, added sugar, industrialized it, and got rich. John kept the principles. Will kept the money. Senior Kellogg also believed that yogurt administered by intestinal enema purified the colon, which he applied to wealthy patients who paid very well for it. The Battle Creek Sanitarium counted among its patients Henry Ford, Thomas Edison, and President William Howard Taft. What exactly they were looking for, we don't know. The first antibiotic that killed over 100 people. In 1937, the American pharmaceutical company S.E. Massengill decided to create a liquid version of the antibiotic sulfanilamide to make it easier for children to use. The active ingredient worked. The problem was the solvent that the company's chemist chose to dissolve the powder. Diethylene glycol, which is the same chemical compound used in car antifreeze. The chemist ran tests for appearance and taste. He ran no toxicity tests. The product was named Elixir Sulfanilamide and distributed nationwide. Over 100 people died, most of them children. The company's head chemist, Harold Watkins, killed himself as the scandal unfolded. The company's owner was fined for misuse of the term elixir, which technically required alcohol. The death of over 100 people cost a fine for incorrect marketing. Directly because of this scandal, the U.S. Congress passed the Federal Food, Drug, and Cosmetic Act of 1938, which, for the first time, required that drugs prove their safety before being sold. It only took over 100 deaths to get there. The doctor who prescribed exercise as weakness. In the 19th century, the American medical consensus on physical exercise was practically the opposite of what we know today. The prevailing theory said the human body had a finite amount of vital energy, called nerve force by many physicians of the era, and that intense exercise permanently depleted that reserve. So doctors recommended rest for almost every complaint. Neurasthenia, diagnosed by American neurologist George Beard starting in 1869, was considered a national epidemic caused by overwork and the activity of modern life. The treatment was absolute rest. The cure for neurasthenia in women was called the rest cure and was created by physician Silas Weir Mitchell. It consisted of weeks or months of complete bed rest with no reading, no writing, no visitors, no mental or physical activity of any kind. Writer Charlotte Perkins Gilman was subjected to this treatment and documented the experience in a short story called The Yellow Wallpaper from 1892, which is today considered an American literary classic. The story didn't end well, neither did the treatment, the plastic surgery that destroyed veterans' faces. During and after World War I, American soldiers came back from the field with facial wounds that medicine had never faced at such scale. New weapons, grenades, and gases caused extensive disfigurements that left men unrecognizable. Reconstructive surgery was in its very first steps. There were genuinely dedicated and innovative surgeons like Vilray Blair in St. Louis, who worked with veterans for years, developing pioneering techniques. But there were also opportunistic surgeons who promised results they couldn't deliver. In the 1920s, American magazines published ads from plastic surgeons promising to fix Jewish noses, thin black lips, and Europeanized Asian features. There was no regulation whatsoever. Any doctor could perform plastic surgery. Some weren't doctors. Many used injected paraffin as facial filler, and the paraffin migrated across the face with body heat, creating grotesque lumps called paraffinomas. There were clients who came in seeking refinement and left needing corrective surgery that didn't exist yet. The yellow fever that taught America how to do science. In the late 19th century, yellow fever regularly killed thousands of Americans in southern cities. In 1878, an epidemic in Memphis, Tennessee, killed over 5,000 people and drove 2/3 of the city's inhabitants to flee. Theories about the cause were many and none were correct. The American Army sent a commission led by Dr. Walter Reed to Cuba in 1900 to investigate. Reed set up the first controlled clinical trial in American history, with groups of volunteers exposed to different conditions under controlled settings. Soldiers and civilian volunteers agreed to be bitten by possibly infected mosquitoes in exchange for $200 and a bonus of $100 additional if they contracted the disease. One volunteer, Dr. Jesse Lazier, died of yellow fever contracted in the name of research. The experiments proved that the Aedes aegypti mosquito was the vector. In under 2 years, eliminating mosquito breeding sites in Havana reduced yellow fever from constant epidemic to 0 cases. Walter Reed gave his name to the most famous American military hospital of the 20th century.